systems are offline.
Number one for today's hits and all-time favorites.
On the plains of Nandi Hills, the waters of Lake Victoria, DURB Radio, we are closing in.
We have had hospital recordings 3 times.
In short, you don't have the details about UHC.
Yeah, I don't have the idea of UHC.
It's a card which you use to get treatment for free in the government hospitals.
He was with the kidney failure and he was receiving medication, free medication through the UHC.
The package covers several areas: emergency services and cancer treatment.
According to the research dubbed as the Human Resource Strategy for the years 2014-2018 by the Ministry of Health, Kenya is facing a great danger due to diseases in 3 categories, which are communicable diseases, non-communicable diseases, and injuries. These diseases continue to contribute to the high disease burden in the country, as much as the Constitution of Kenya 2010 devolved health services to the counties, which meant a complete change in the health management in the country. This challenge led to the establishment of Universal Health Coverage (UHC), followed by its launch on 12th December 2018 by President Uhuru Muigai Kenyatta. It was the precedence of affordable healthcare, which is also one of the big 4 agendas for the Kenyan government, rolled out to its citizens with its initial piloting in Kisumu, Isiolo, Nyeri, and Machakos counties. According to Mr. Fred Oluoch, the Director of Public Health in Kisumu County, the uptake of UHC has had high recordings, 3 times the initial number, an indication of high universal health coverage sensitization level to Kisumu residents.
We have had hospital recordings 3 times what they were recording before. That means uptake and utilization is so high that has tripled.
Mr. Oluoch adds that hospitals have recorded 270% increment in the number of patients seeking healthcare services within the county. Although vis-a-vis COVID-19, this progress began falling as people feared contracting the virus while seeking medical services in the health facilities.
Yes. So you realize that some hospitals having 270% increase in number of patients seeking healthcare services.
Yes.
We had some at least decrease in the number of clients seeking health seeking health sometime in April.
Yes.
April and May there.
Yes.
I think that was because people feared the corona and they thought that if probably they go, they might meet people who have it in the hospital. So I think there was a decrease then, but after sensitization and awareness, that we are still offering other healthcare services at the background of COVID.
Yes.
I think people came out and started seeking healthcare services, and of course, this has seen an increase in number of clients again. So we are actually seeing now the people coming back for healthcare services, and it's to its normalcy.
Though sensitization has been done, there are still some Kisumu residents who don't understand universal health coverage and its working model, calling for more awareness campaigns. Take for instance Peter Okech, who is a carpenter.
With now, I can't say anything about that, but it's about health. Yeah, and some things it deals with health and many others.
And in terms of health, has anybody tried to approach you from the health sector, trying to explain to you what it's all about or anything of this sort? Or how did you come to know about the term?
The term I had it because I heard it on a radio station which was talking about that universal healthcare. That's all. But I've not come across anybody who have tell me or make me aware of that universal healthcare.
So in short, you don't have the details about UHC.
Yeah, I don't have the idea of UHC.
Terry Alang, a Kisumu resident, is a beneficiary of UHC, and she explains her experience.
Okay, my brother was sick. He was with the kidney failure, and he was receiving medication, free medication through the UHC. He was going through dialysis twice a week, and we were doing it free because UHC was covering it.
Benta Ochola, a single mother and a Kisumu resident, pretty well understands universal health coverage, which has directly had impact on her own health.
I know that UHC stands for Universal Health Coverage, and it's a program introduced by the Kenyan government to help people in the healthcare sector. So it's a card which you use to get treatment for free in the government hospitals. So far, I haven't had any difficulty using my UHC card. Anytime I visit a government hospital, when I get to the reception, usually they ask, do you have the UHC? And yes, I tell them I do have. So I'm asked to produce my UHC. Then they take the details, they enter in their record books, and then after that, I'm able to access treatment for free.
So have you heard of friends who maybe have not yet registered with the UHC?
Yes, I know of people who have not registered.
And what are their reasons for not registering, maybe just from your end?
Some of them did not come across the people who are registering, so I think they were passed by. They were not able to register in good time, and then they don't know where to start the registration process. They're not able to get help per se unless they have to pay for some services. Like for me, recently I visited the referral hospital here in Kisumu, and I had to be done for different tests. I did not have to pay a single coin, but then those who had to do the same test without the UHC card had to pay for those services.
Even though the window of UHC registration was closed in the 4 piloting counties, Kisumu, Nyeri, Isiolo and Machakos, the introduction of indigence insurance scheme was placed in favor of those left out of UHC registration in the country, as Mr. Fred Olwoj explained.
Well, the window actually for registration of UHC, it closed some time back.
Yes.
What we are now talking of now
Yes.
is what we call indigence insurance scheme.
Yes.
And this basically targets the poor.
Yes.
And in Kisumu, it's called Marwa.
Yes.
It's called Marwa, and this basically targets the poor, the low economic clans.
Yes.
And this before we had started this one, and this was based on the previous UHC registration data.
Yes.
And we target to register around 90,000 households.
Yes.
And we expect that this will cover at least 270 270 clans.
Yes.
So basically we expect it to be like we can cover around 300. But of course in the new UHC scheme, the national scheme that they are looking at, the service provision that they expect is that the national government is also going to of course register some indigents again, and that will now increase our household coverage again.
He is optimistic that in 5 years, his hope is to have a UHC model which is insurance-based, where National Health Insurance Fund is getting empowered, enabling those who can afford paying for NHIF to do so while the disadvantaged can be paid for.
Well, my hope is that we are going to look at a UHC model that is anchored on insurance-based,
Yes.
where we need to see NHIF getting empowered,
Yes.
and people who can afford paying for NHIF can pay NHIF,
Yes.
and those who are not capable can be paid for, like the ones you're talking of, the Marwa indigent scheme. So if this happens, then that means that the hospitals can sustain their services.
Yes.
It means that they can people seek services, then NHIF pays back, reimburse for what has been used.
Yes.
NHIF can as well give capitation to hospitals so that they can equip and make sure that they have the services that the citizen need.
Yes.
Then I think it will be just rolling and rotating, and you give services, the money is reimbursed, and it is sustainable. So that is the kind of UHC that I think we should run.
Cancer and mental health issues were recently added to the list of diseases covered under UHC. This became evident on 31st October, the year 2020, in the Health Sector Intergovernmental Forum on Universal Health Coverage held in Mombasa. According to the Kenyan government, this shall include 1.2 million vulnerable households all over the country amid countrywide biometric registration, which was launched during the forum with an assurance of quality and affordable health services by adding more incentives to the already existing package, as President Kenyatta clearly states.
Package covers several areas: emergency services and cancer treatment, as well as ensuring that we take care of the mental health of our people.
Even with the rollout of UHC, an average of 2 million Kenyans have been parting with close to 4,000 shillings annually to seek medical attention. Therefore, the ball is now rolling on the Kenyans' court to embrace the biometric registration in order to tap into the quality and affordable healthcare services and avoid digging deep into their pockets. This could be the wealth unknown to us. Reporting for DURB Online Radio, I am Eli Olieng.
You are listening to DURB Radio.